KP Video News.
KP's Video News, y'all. That's right. And it's been a lot of stuff going on here lately, and sometimes it's just so much stuff that they keep throwing up in the air to try to divert you from what's really going on. And so I did a recap on a story of a couple of weeks ago about how Michael Cohen had took $1.2 million from a company called NOVARTIS in order to give the DC dunce Trump a meeting, to have a meeting with Trump. So basically what they was doing was paying to get a chance to meet Trump and this company Novartis. And so mysteriously 3 weeks ago, President kept talking about this drug, hydroxychloroquine here, and maybe I might be pronouncing it wrong. Hydroxychloroquine. All right, I'm gonna say it that way. Hydroxychloroquine. I'm just gonna call it from this point on. I'm gonna call it HC. This drug called HC, and it's a malaria drug. But turns out Trump had invested a lot of money in this company called Novartis, and that's why he keep talking about this drug. Yeah, we got to try this drug out. It might help. It's a malaria drug. It'll help cure the coronavirus, knowing damn well the shit wasn't gonna work. And so that leads into this story right here. And a malaria drug widely touted by President Donald Trump for treating the new coronavirus showed no benefit in a large analysis of its U.S. veteran hospitals. Wow, so they're experimenting on the veterans at the U.S. Veterans Hospital. Wow, there were more deaths among those given HC versus standard care, researchers reported. The nationwide study was not a vigorous experiment, but with 368 patients. It's the largest look so far at HQ with or without the antibiotic azithromycin for the COVID-19, which has killed more than 171,000 people as of Tuesday, and today is Thursday. The study was posted on an online site for researchers and has not been reviewed by other scientists. Grants from the National Institute of Health and the University of Virginia paid for the work. Researchers analyzed medical records of 368 male veterans hospitalized with confirmed coronavirus infection at Veterans Health Administration medical centers who died or was discharged by April 11th. About 28% who were given the HQ, that's hydrochloroquine, I'm just calling it HC, who was given HC plus usual care died. It's 28% of them died versus 11% of those getting routine care alone. About 22% of those getting the drugs plus azithromycin died too, but the difference between that group and the usual care was not considered large enough to rule out the factors that could have affected survival. HC made no difference in the need for a breathing machine either. Researchers did not track side effects, but noted a hint that HC might have damaged other organs. The drug has long been known to have potentially serious side effects, including altering the heartbeat in a way that could lead to sudden death. Earlier this month, scientists in Brazil stopped part of a study testing HC, and all the drugs similar to HC, and after heart rhythm problems developed in 1/4 of people given the higher of 2 doses tested. On Tuesday, NIH issued new treatment guidelines from an expert panel saying there was not enough evidence to recommend for or against chloroquine or hydrochloroquine for COVID-19, but it also advised against using HC with azithromycin because of the potential side effects. Many doctors have been leery of the drug. At the University of Wisconsin-Madison, I think we all rather underwhelmed at what's been seen among the few patients there who tried it. Patients asked about it soon after Trump started promoting the use, but now I think that people have realized we don't know if it works or not and needs more study, said Dr. Sabdar, who had no role in the VA analysis. Despite warnings from the NIH that HC shouldn't be recommended until more testing is done, Utah officials said Tuesday the state would buy 200,000 treatments of the drug. In a statement, Tom Hudako, spokesman for the Utah Department of Health, said patients with the prescription will be able to get the drug free of charge. He said the final cost of the purchase is not yet known, and the purchase contract with meds in motion is not finalized. The state says federal government would pay 75% of the cost and the state will pay 25%. So Trump is making his money off of this drug, man. He's been pushing it out there, knowing damn well the drug doesn't work. No, it doesn't work for the coronavirus, and people are dying from using it, having heart attacks and dying from this drug. So if anybody comes up to you talking about, yeah, we want you to try this hydrochlorine, and, don't do it. Don't do it, because they will just be using you as a guinea pig. They won't be using me, because I refuse to take that mess. And so going from there to this story here, this is a teen that killed his family because they were against his black girlfriend. And it's Levi Norwood, a 17-year-old white teen, allegedly killed his mother and brother because he believed they were racist for disapproving of his black girlfriend. His father recently died after allegedly committing suicide. Levi allegedly shot and killed his 34-year-old mother, Jennifer Norwood, and his 6-year-old brother, Wyatt, last February inside their home in Farquhar County, Virginia. He then allegedly waited for his 37-year-old father, Joshua Norwood, to come home and shot him in the head, injuring him. Levi fled the scene with the stolen car and went to North Carolina, where he was found shoplifting at a Target store. He was arrested and is being held at a regional juvenile detention center awaiting trial. Most recently, his father was found dead inside their home. Authorities said no foul play is suspected and believe that he committed suicide. His cause and manner of death have yet to be confirmed by the medical examiner. Their relatives believe Joshua killed himself because his pain was so deep and he saw no other way out. Joshua's aunt, Rebecca Norwood, noted on Facebook. He told me he died the night his wife and little boy were killed, and he was just an empty shell of a person. After his death, Joshua was criticized when his apparent racist behavior surfaced on his Facebook. He and his wife were allegedly against their son having a relationship with the black girl. Wow, that's crazy. That is a crazy story right there. Just goes to show you, boy, racism is alive and well in the United States. Here we go. Attorney helped save black men's lives by calling for a suspension of anti-mask law during COVID-19 pandemic. And it's Gerald Griggs, an attorney and VP of the NAACP's Atlanta branch, had begun calling for the immediate suspension of the anti-mask law during the COVID-19 pandemic to help protect the safety of black men in Georgia. Just 5 days later, the governor signed the executive order. In 1951, law states a person is guilty of a misdemeanor when he wears a mask, hood, or device by which any portion of the face is so hidden, concealed, or covered as to conceal the identity of the wearer, and is upon any public way or public property or upon the private property of another without the written permission of the owner or occupier of the property to do so. The punishment is a fine of $1,000 and 12 months in jail. Now this, let's state that again. 1951, this law is from 1951, and here it is, 2020, it's 2020. And so anyway, on with the story. On April 9th, 2020, the viral video of police following a young black male and escorting him out of a supermarket because he was wearing a mask reminded Atlanta-based attorney and NAACP Vice President Gerald Griggs of Georgia's own anti-mask law. 4 years earlier, the Georgia NAACP led a protest of over 15,000 people. During that protest, police informed Attorney Griggs of Georgia's anti-mask law to prohibit arresting protesters. Out of fear of more young black men being labeled as suspicious, detained, and possibly incarcerated, Griggs began reaching out to the media and the head of the Democratic Party, State Senator Nikema Williams, and DeKalb County Judge Stacey Hydrick, after Georgia Senator Williams wrote a letter to Georgia Governor Brian Kemp. Atlanta Mayor Keisha Lance Bottoms issued an executive order suspending Atlanta police from making an arrest under the law. In the middle of a pandemic, we have to make sure we hold elected officials accountable to the will of the people. Laws should be more sensitive to the needs of public health. I want to thank Governor Kemp, Senator Williams, and Mayor Bottoms for hearing the pleas of the people and protecting their rights. Attorney Griggs has been releasing live updates about COVID-19 and on his podcast, and that's a good thing. Got to give him a heads up on that one. That's a double ring on that one. You know, they're trying to get rid of this 1951 law still on the books, man, saying you can't wear a mask in public, otherwise you get arrested or $1,000 fine. Boy, I'm telling you. What do they think of next?
KP's Video News. KP's Video News, yo.
Peace, y'all. KP's Video News.
KP's Video News. KP's Video News, yo.